Hello and welcome to another issue of Qigong for Health with me, Andy Wright, Qigong trainer and instructor. And today I want to talk to you about OSA, obstructive sleep apnea. Sleep apnea is when you're asleep and your body awakens very briefly because you have stopped breathing or you're having difficulty breathing. This could be because your throat is blocked with your epiglottis, this little flap of skin in your throat. Now obviously when you're asleep you're relaxed and the epiglottis will relax and it will try and it won't deliberately do it, but it will cover up the airways, and this is also what causes mainly causes snoring. So if you're a snorer, then you really need to be thinking that you're worrying about OSA and getting checked out, because this is the first sign of having OSA. I'm actually been going through this process myself, so I can talk to you categorically that OSA is quite a serious thing. For me, it's been coming on for the last 3 years, and unfortunately it's got to the point where OSA has caused high blood pressure, which is one of the signs and symptoms that comes from OSA. And OSA itself is quite dangerous because you can actually stop breathing altogether and you can die. However, hopefully the body will keep you alive by waking you up. What it will create is problems with your health. OSA can be, obviously I've mentioned hypertension or high blood pressure. You can have severe tiredness and inability to function in the daytime. You will probably need to catnap. So these are quite serious things if you're doing a full-time job. And if you're lucky enough, a good sign is that your body will wake you up briefly, but you might not know that you've been woken up. The only time that you will know is either in the morning when you're very, very tired still, or you have this banging headache. And I'm suffering from the banging headache, which has been the outcome of developing high blood pressure from sleep apnea. So for me, I need to treat the OSA first. I need to get that sorted out, and at the same time start to work on the hypertension. So you can get more information about the hypertension that I'm on about is in my other video, which is at the top at the moment. I mean, the only thing that I will tell you is that if you are a snorer, then please do look into this, because it is quite a serious thing to have, and it does come on generally through snoring. Snoring is the first sign of OSA, and if you let that get worse and worse and worse, then OSA will develop into other things, and it can also help you, it can also affect your other aspects of your life. If you're on medication, as I am, this can also be a factor in developing OSA. Now, I've been on codeine and paracetamol and other drugs which are prescribed. These all develop tiredness and sleepiness in the taker of it. So that means that you actually go to bed more relaxed than you would be if you weren't taking them. And obviously this will allow you to lose the ability in the epiglottis to maintain the airway. It can be a factor in speeding up the development of OSA. So there we go. If you've any doubt about your health or OSA, or you want some more information, then go and talk to your GP, because it is quite important to remember that I am not a qualified doctor or GP. I am a Qigong trainer and instructor of Chinese healthcare exercise and systems. So I have knowledge of how to cure things, but I can't tell you about it, I'm afraid. So you need to go and get some professional advice. If you can, then join a class, join a Qigong class near you, and reap the benefits of how it can help improve your health. Okay, thank you for watching, and bye for now.